Hello, and welcome to the Body Fusion Therapy Podcast. I'm your host, Dr. Heather Demirci. This episode is a bonus episode. It's not kind of the normal things that I talk about in terms of how to look at the body and help recover from injuries. It's a little bit of a deeper talk, and so that's why I'm making it a bonus one, because I understand a lot of you guys come here to listen about how would I treat the body or things to look at. But I also know that a lot of my followers aren't just patients or would-be patients, they're also healthcare providers. And I think this is an important topic that we need to discuss as healthcare providers and be able to understand the differences between a mentor and a coach. So kind of the catalyst of this conversation today, of this bonus episode, was because of the unfortunate passing of a mentor of mine, Dr. Mary Hickey. She was a professor of mine at Northeastern University in Boston, and she recently succumbed to breast cancer, which I had no idea she had. And it sounds like from the conversations with my friends that no one really knew about it. But unfortunately, she passed away, and she was an amazing mentor. And I had thought about talking about this as a subject before on this podcast, but I was thinking, you guys just want to hear more about injuries. You don't necessarily want to hear more of the philosophical talk about things. But as in another area of my life, Mary Hickey was a catalyst. So we're going to talk about this, and hopefully you guys enjoy this a little bit of a different episode. So I'm going to talk a little bit about Mary first so you guys can understand how amazing a woman she was. And then I want to talk about the difference between coaching and mentoring and how important it is to have a mentor in your life versus a coach. So let's talk about Mary first. Dr. Mary Hickey was just a badass. Pardon my language, but she was a life force, and she was an amazing professor and physical therapist and just human being. She was that woman who didn't matter if the student was male or female. They wanted to be Dr. Mary Hickey when they grew up. I don't know how many conversations I had with my classmates saying like, man, I just want to be like Mary Hickey when I grow up, because she was just amazing. She was still practicing and seeing patients, and then she'd come and lecture to us and run labs. And she was just so pragmatic about how she approached patient care, which was so nice to hear, because in like all industries of life, when you're in school and learning about it, it's like the teachers paint this utopian society of like what working in this field would be like. But then when you actually get out there, you're like, what? No, this is not what I thought it was going to be. And she was so great about being pragmatic, and how she taught was about like, well, this is how I would treat her. This is what I would have time for, because in school, they make it seem like you're going to have like all this time in the world to do as many tests as you want on the patient and do all these exercises, and it's always going to go well. That's not the case, especially if you work like in an outpatient practice where you're seeing patients every 30 minutes. You don't have the time to do like 6 to 10 objective measures to see if your diagnosis is the correct one. It's just not the way it happens. But we had teachers that taught us like that. But Professor Mary Hickey, Dr. Mary Hickey, she was not like that. She really told us how it was, and it was so nice and refreshing to get that perspective. She was also just a great example of a strong female in the field of physical therapy. I was looking at some statistics prior to doing this talk because I just wanted to see, because I know I've heard these things, but I wanted to actually see the figures. And in the field, about 2/3 are women of physical therapists. About 2/3 of them are women, 1/3 of them are men. But when you look at the income, it's about $20,000 a year difference, that men get $20,000 more on average. Some places it's higher than women do, which is just horrific if you ask me, especially if we make up 2/3 of the workforce. How is it that they make $20,000 more? So sometimes that's actually, they make over 20% more than women do. That's just mind-boggling to me. But I remember talking to another professor of mine, Professor Watkins, who was a badass in her own right. And she was saying that she thinks the income disparity is because a lot of women don't go into that managerial role, or oh my goodness, own a practice, right? That just seems crazy. Like, a women don't really do the business side of things. They just want to be physical therapists and not do anything else. And so then the men will kind of jump into those roles a little bit more. And even though they are less of the percentage, they make more of the money. So I now see female physical therapists that are owning practices, and it makes me so happy as one as well. And you definitely try to make your little group of like, let's band together, because you're kind of fighting an uphill battle sometimes. And so it's just great to have a female that was such a strong presence that, like I said, it didn't matter if the students were male or female. They all wanted to be Dr. Mary Hickey when they grew up. So this kind of gets into, like I said, that she was a catalyst for other things in my life. She was a catalyst for doing my residency program. And I remember we were about to graduate, and I think we were waiting for a lab, and we were just waiting outside, and a bunch of students and I were talking, and she was just kind of overhearing me say that I had an opportunity to, if I wanted to do a residency, a postdoctoral residency with the Institute of Physical Art, that I had opportunities. I had a couple places I could look at and go and do that. But I just kind of said offhand, like, I don't know if I want to do that though, because, I've already paid so much money for school, and I'm going to be paying more money and not making as much if I do a residency. Like, I kind of just want to make some money. I don't know if I want to do it. And she stopped me, and she came into the conversation. She goes, you have the opportunity to do a residency with the IPA. You've been offered that. And I said, yeah. She goes, okay, great. Well, if you don't take it, let me know, because I'll do a year sabbatical and I'll do it for you. And she's basically telling me, you're an idiot if you don't take this opportunity. Like, do you realize what you have in front of you? And I didn't. But the fact that Mary saw that was like, oh, okay. And that kind of what brings me into what is a mentor versus a coach. Because Dr. Hickey was a mentor. She was not a coach. So what's the difference? This is something that my dad and I have talked a lot about, because he always said, find the mentors, don't find the coaches. Coaches are going to have a little bit of a selfish reasoning to working with you. They want you to win for their team, whether that be that you're their employee and you make them more money. So they're really happy about that. And they're kind of looking at it as to what is their monetary gain. Or maybe you can do something else for them in return of them mentoring you. Or maybe it's going to be a feather in their cap that I mentored so-and-so. That person is going into it for selfish reasons. I mean, you can be a coach and not be completely selfish, don't get me wrong, but a true coach, there's a little bit of selfish reasoning into there. While a mentor doesn't have any selfish reasoning. Professor Hickey had no benefit if I did my residency program. None at all. She wasn't going to be able to like put a feather in her cap or put in her signature in her email, like, convinced Heather Demirci to do a residency. No, she just knew that it'd be a great opportunity and saw what my skills were in PT school and what I was kind of drawn to, and was like, this is a great opportunity. This is where she should go. So I found a mentor. I didn't find a coach. And I took her words much more at face value, because I knew that she just wanted the best for me. And so I think when you're trying to find someone to help you, if you're new in a career or in a new endeavor, it's important to take the time to search for a mentor, not a coach. I've been lucky to have many great mentors during my professional career, and I think you can still be an employer and be a mentor, because I've definitely had bosses where their sole purpose for taking me under their wing and, doing their residency or doing a fellowship was so that I improved as a therapist, so that I could go out and help more people. I was taking their time and their wisdom and adding it to my skills to be better at what I do. I mean, yes, did they get more money because I was able to be a more effective therapist and I would be able to see more patients and improve my reputation? Yeah, but that wasn't their sole purpose of it. Their sole purpose was that I really understood the information. I could figure out what I needed to do with patients. It just made me more effective. They were sad to see me go, but it wasn't like they were sad to see me go because of the relationship we had formed, not because like, oh man, they're not going to make me money anymore. No, they were just sad to see that that relationship was going to change, but it wasn't because of selfish reasons. It was because of selfless reasons. And I would not be who I am today if I didn't have those mentors in my life. I have had coaches in my career too, and I've had coaches in school, and, I've had coaches in swimming, and even like in sports. You can have a coach that is a mentor and not really a coach, or you can have a coach that's a coach. So I think it's really important that you, as you go out into a career, or go out into a new endeavor, that you look for those people that really, truly just want you to be the best version of yourself and to improve upon and help you figure out what this new endeavor that you're going into, rather than being so concerned about what do they get out of it. And I think also too, if you are a person that's going to be in the position as a mentor, having a mentee, you need to kind of check yourself and say, do I have any ulterior motives? Why am I going into this? Because you're just not going to be as effective, and you're not going to feel as fulfilled if you're going into it and not going into it for the right reasons of just trying to improve someone's life. I love when I get emails from students that I've had in my continuing education courses. They write back and just tell me how that information that they got in that course has just been able to improve how they treat patients, how they've been able to see things in a different way. That is for sure the benefit that I get out of teaching. I think that's the greatest thing that can happen, is those emails or those letters that I'll get from former students. I mean, yes, do I get some money from teaching? Yeah, but it's not a lot. I do it, honestly. I do that teaching because I want to make better physical therapists out there. That is my sole purpose, is I want there to be more people in the world that are in less pain, and in less pain quicker, because they have a very good therapist that is competent and is able to look at the body in a little bit of a different way. So if you're going to be in a position where you're going to be in the mentor role, just kind of stop back and just kind of wait for a second and be like, what am I trying to get out of this? What is my purpose of doing this? Because the riches will come if you have the right endeavors, right? I remember talking to another mentor saying, like, if you're going into physical therapy to become rich, you've gone into the wrong field. But you know what? If you have your right intentions, the money will come in. You'll be surrounding yourself with good people. It's going to be where you want to be. So it's just kind of how you set your intentions going into any of those situations, and just realizing that along the way, you're going to need help. And everyone needs help as they go through in a new endeavor, but just to try to find that mentor rather than that coach, because that mentor is going to be cheering you on the sidelines, and they are going to be the loudest ones around because they're just going to be so happy for you. I hope that everyone is going to be able to find their Dr. Mary Hickey, that person that can help them achieve greatness, that's going to be cheering them on the sidelines, because it's something that I'll never forget. And like I said, finding about her passing last week just really hit me hard in a way that I wasn't expecting, but it just goes to show how much I appreciated her in my life and everything that she did. And hopefully when you get the chance, you can be that for somebody else too. So go out and find those mentors. Thank you for tuning in to this episode of the Body Fusion Therapy Podcast. Please share it with your friends and family, as well as leave a review if you liked what you heard today. We're looking forward to continuing this journey of looking at the body. Tune in next time.